Okay, oh, we've started. Hello, hello. Today we have Hallie O'Gorman here with us. She's an acupuncturist that works at our clinic, Buffalo Pelvic Health and Acupuncture Clinic. And I'm really excited to chat with Hallie today because we're going to actually shift gears a little bit today and talk about children. Our children, we'll dive into how acupuncture can be like a supportive modality for children. We don't really think of with acupuncture as something that we could use for children. Um, and I think this can be really helpful for any of us that are parents or we are in relationships with people with parents or we are aunts, uncles, whatever, grandparents, because I think when it comes to our kids, it's just a little bit sensitive because children are very different from adults. And so I think a lot of us, especially when we are in the role of parenting our kids, we sort of lose sense of that. So, anywho, I'll shut up. It's time for me to introduce Hallie. So, Hallie, tell us a little bit about you and your practice,
Hi, Kathleen.
your
Yeah,
life.
yeah. Well, I was actually just thinking you sparked my desire to kind of chat about my first exposure to acupuncture was as a child. My mom had fallen down some stairs and just had a horrifying outcome from that fall. Her spine was very negatively impacted. They told her she wasn't going to be able to walk if she didn't get massive surgery. And my father was a chiropractor, and she was brave enough to say, "No, thanks. I'm going to try other methods first." And so through chiropractic and then acupuncture, she would take me because she was going like 3 or 4 times a week, and she would take me with her to her appointments. And that was where I first started to get exposure as a young kid and kind of see the different ways people can seek treatment. And Dr. Gong was his name. The acupuncturist, he also taught a qigong class, and he's like, I never invite kids, but like we had just become family at that point because we were seeing each other so often. And so he invited me to take a qigong class, and it was just a I just really appreciate that as a childhood memory, and kind of getting a glimpse of how, there isn't just one answer for everything. And that's no shade to Western medicine, but people can kind of go on their own journeys and see what's out there. And it really helped me understand how to advocate for my own health at a young age. It helped me understand that. So I'm appreciative of my childhood exposure to that. My mom made a full recovery, walking fine, didn't have to have any of the surgeries and things like
Wow.
that. So
Wow.
it's yeah. So I along a sort of roundabout way of saying I really love treating children, and I think that experience really kind of influences why I do it. And I see a lot of times myself and these kids coming in to either receive treatment, or if parents bring in kids to their treatments, it's like a full circle sort of thing for me. It's really rewarding. So I love treating kids of all ages, from infancy up to young adulthood. um, and and I know that people who aren't familiar with the treatment of pediatric patients can be like needles in kids, and it doesn't always have to be needles. We can do a lot with acupressure, with herbs. I have these tools called shonishin tools, which are Japanese style acupressure tools, and they're kind of fun. They're retractable, and they can do like some scraping with them, and so the kids get a kick out of it. And um, yeah, it's a really I treat patients of all anyone who's seeking care. I'd be happy to treat, but I really love
That's
treating kids.
amazing.
Yeah.
So, tell me a little bit about like, I think people forget, and I'm raising like a preteen right now, so I certainly forget, like, because children, like, we're developed as adults, right? We've already gone through like the whole developmental process, whereas children, like, their nervous system is so malleable and so treatable because they're so young. So tell me some of the things that are like you notice are really like different about like treating kids versus treating adults, other than, the fact that they're small and
Sure. Yeah, yeah. I just noticed they respond so much quicker with such less intervention, generally
hmm
speaking. it's kind of amazing. You know, you can do gentle sort of acupressure. You can do gentle, what we call a gua sha, or a scraping technique on the meridians, and just kind of clear out energetic stagnations. And kids tend to respond really well. And it's sort of amazing to see how receptive they are to it generally. Like, you kind of think that kids have a hard time sitting still, and they have, you know, it can be tricky to treat, and sometimes that's the case, depending on what we're treating, of course, too. But they seem fascinated. Most of my pediatric patients seem really fascinated by it, and they seem like they it doesn't take much. And a lot of the times they're like, "Can we come back again tomorrow?" It's like, it's kind of reframing how they see a trip to the doctor, which I
Yeah.
think also really beneficial.
More interactive for them.
Exactly, more interactive, kind of helpful in combating early developed white coat syndrome. You know, yeah, I think that's probably the biggest thing I notice in treating kids, is like how surprised I am with how receptive they are, and how well they generally tend to respond. And again, with very little intervention, it's kind of amazing.
That's really cool. So that just made me like think of a question, because adults, you know, I treat mostly adults, but I
Mhm.
have children. So my perspective on children is not that of a clinician, it's of a, you know, kind of like fried mom. But adults have a very like, I see a lot of patterns in adults' relationship to their symptoms. For example, like when an adult has like chronic pain that like seems to progressively be getting worse. And like we know, and we've talked about it in a bunch of our talks. So a lot of people that are listening are watching this know this, that like even though our pain can progress and get worse, right? It doesn't necessarily mean like that we're getting worse, but people get to a point, you know, when they come to see us, and I'm sure you experience this often too, Hallie, is that adult patients are like, I'm broken. And they have this like whole narrative around their symptoms. Like, I'm broken. Things are getting worse. I've been doing so much damage. Like there's like, they feel really like hopeless. Do children have a different set of patterns of like, I guess like relationship to their symptoms? Like what is like the some of the personality traits, or the sort of like response to symptoms that kids experience? I'm really genuinely just curious.
Yeah, yeah. Well, you know, the joke in Chinese medical school is the answer to every question is it depends. But
Yeah.
the it's interesting to see clinically patterns of children responding to illness or ailments or pain in very similar ways that their parents respond to
Okay.
illness or
Mhm.
pain. So, you know, they learn, of course, they learn their cognitive behavior from the adults and their caretakers that are around them constantly. So it kind of makes sense. Um, and and it's not always 100% the case. And I always try to really emphasize your body is always trying to get better. Even if it doesn't feel like you're getting better, your body's always trying to get better. You're always in the process of healing. It's always working towards better health. And a lot of times the advice I give is not only for the kids, but for whoever's in the room supporting the kids. And
Mm.
it it's interesting. But yeah, I do think because kids haven't had so many experiences of their health taking over their lives generally, and you know, in ideal circumstances, they're not as jaded. And so adults tend to really, I think, you know, the longer you're alive, the more you see sad stories and of illness and pain and things like that. So it kind of gets in your brain a little bit more. You're more in your head about it. You're more, you know, there's more of a doomsday association with it for a lot of people. But the kids, they haven't had as much life experience. They're just trying to be kids. And so they don't, I don't think they put as much weight on sickness, unless, you know, unless it's an unfortunate case where they've been in the hospital for, you know, on and
Yeah.
off, like major
Mhm.
illnesses,
Right.
things like that. But I would say yes, as a
That's
general rule, they're easier to move past hurdles in their health because they know they can. You know, they haven't seen it
Yeah,
go.
they don't deal as much with the psycho-emotional barrier that our adult patients deal with.
Yeah, not quite baggage. Yeah.
Yeah, yeah, wow. And yes, with their nervous systems being so malleable because of the neuroplasticity that still exists and the fact that it's still developing, it certainly makes sense that the sooner we get in there, the easier
Yeah.
to treat.
A major influence on the developmental like process of the nervous system. It's what they call serve and return, where babies particularly, but young kids, they will serve a gesture, they will serve like a, you know, some sort of experimental outreach of either like a laughter or touching something, or like just to kind of test serving out whatever, you know, whatever their impulse is. And the return is how the caregivers in their lives respond. And so if they if they get a constant stream of what you call toxic stress, so that could, you know, I think it's pretty clear what toxic stress would be: some sort of abusive relationship or just lack of response. If the babies are, or young kids are being ignored and not
Mhm.
getting kind of response when they're delivering whatever gesture they're putting out, it actually has a negative impact on the developmental architecture of their brain synapses. And
Mm.
the synapses that are developed at that age are the foundational building blocks for future more nuanced systems in the brain. And so, and that goes on to be cognitive behavior, social skills, learning development, things like that. So it really is a very impressionable time. It can really set the tone for
Mhm.
their life experiences all throughout adulthood. And so it's, you know, kind of scary to think about how impressionable young brains are. However, the other side of that is early intervention is twice as effective, right? So if
Right, right.
so there's some malleability there, and it's, and you know, when you're, it's something like a million new neuron connections are formed like every second in the first few years of development. It's something asinine like that. It's just
Oh my God.
just firing and firing and firing and building and learning and adapting. And then as you get older, it's a pruning process happens where it's like the brain kind of sifts out what's necessary, what's being used, and what's not so necessary.
Yeah.
Um, but yeah, it's important. It's important to give, you know, you think, oh, that baby's so young, right? You know, they're not gonna remember this, or they're not gonna download this, or they're not, you know, it's easy to kind of just say those things, but the brain really is always picking up on body gestures, on cues, on touch, on like all of that is just very,
All
very
that
important.
sensory information that's, yeah, I mean, the nervous system from a PT perspective, and I use this in my methodology for treating adults, the so much of the development of the nervous system relies on the sensory input. So head position, mechanoreception, so the connection to the ground, so to develop like proprioception, and then like integration of like all the primitive reflexes that, you know, we're born with, the grasping reflex and some of the other reflexes. So sensory information is like so incredibly important. So I would imagine that even as children, you know, not just babies, but children can benefit so much from appropriate sensory input. So let's talk about some of the things that you treat, and maybe like even if there's any, if you have any anecdotes about certain patients of yours, or even like certain symptoms you've seen or presentation of symptoms you've seen, and like what you've sort of traced them back to in terms of like the source of some of the symptoms. That would be super interesting, and I'm sure people would love to hear about this,
Yeah.
because
Yeah, well, lately I would say the trend for my pediatric patients I've been seeing a lot is behavioral issues. Like kids feeling like they're not in control of their emotional responses, either firing too harshly at their loved ones, or becoming really, really introverted, not eating, not, you know, just sort of shutting down emotionally. I've been seeing a lot of that lately. And
what age group or all over?
It varies. Yeah. I'd say the youngest one would probably be about 4 or 5.
Oh,
He's
wow. Okay.
He's
Yeah.
got, yeah, a lot of issues with food. There's no known trauma for him. And no one, they've tried to do all sorts of counseling. They've tried to do, work with nutritionists and food therapists and things like that. But there's maybe 1 or 2 things that he'll eat a few bites of, and
Oh, no.
he's really having some developmental issues. And of course, he's not getting the nutrition he needs, and no one really knows why. He just seems very melancholy. And so we're doing a lot of work with, ironically, with herbs, the tincture, that we actually sell a few different tinctures at BFAC, from Con Herbs. There's one called Thrive and Grow. And so just been working in, like, he'll drink juice, and so they'll put a couple drops in his juice, and starting to slowly kind of see at least his tendency to eat is starting to improve slowly.
Oh, wow.
And so, but because he's so young too, and he's like very temperamental, we haven't done anything other than herbal support for him. But I'm
Okay.
hoping that the more nourishment he gets, the more he starts to feel better, the more open he would be to some sort of manual therapy, whether that's, acupressure, or sometimes with needles, we can just do in and out, like in normal acupuncture treatments. You have the patient lay there with the needles retained for about, half hour or so. But with kids, like I said, they respond so well. Sometimes you can just go in and out, and then
Wow.
and that's really, very helpful and impactful. So, but I yeah, the behavioral trend is something that I'm getting more well versed in, and I really have seen kind of a correlation between, what I think clinically, is blue light influence from screens
Mm-hmm.
having an impact. I had a patient who was 11. She sort of tipped me off in my clinical thinking. She was like, "Yeah, I watch every time I watch a movie, I get grumpy," and and I was like, "What
I
an
mean,
idiot!"
what an observant, amazing little being for noticing that, you know?
Would never piece that together. And but that just like clicked in my head, and I was like, "So when are the other times that you're getting grumpy?" And like, oh well, in school when they're using more and more screens, and like, oh, sometimes I'll sneak in my room and watch YouTube, and then I can't go to sleep, and if I don't get a good night's sleep, then I'm really grumpy the next day. And like, so it's a newer thing to observe in kids, the impact of
Mhm.
screen time. And I don't think I would, never advocate for no screens. It doesn't seem like a feasible way to go through life, but
It's just, you can't, yeah.
yeah. So it's about adapting and sort of learning the best ways to support developing nervous systems as they're getting all this bombardment. We're so, as adults, are very susceptible to the outside stressors in our environments, but it's twice as much for kids. And so it's just useful to have tools in the kit to kind of help navigate through this newer world.
Oh my God, yeah. And even if they're with you for an hour, they're away from a screen for that long, at the very
Exactly.
least, at the very
Exactly.
least, a little bit of rehab.
Yes, a little bit of unplugging, and that's something I tell all of my patients, no matter what the age is. I was like, this is a rare chance to unplug. This is a
Yeah,
gift in itself. Even if we
I
were to do nothing, that's therapeutic because of
I know.
everything.
We have to put a box like at the desk where people put their Apple Watches and their phones. Like we should just be like, this is a screen-free environment because the number of
Yeah,
times I have patients like, looking at their watch.
sure, of
I don't
course.
even know they realize that they're so distracted when they're just like so engaged with their watch in the middle of a conversation. Okay, so some behavioral stuff. What other things? That's really amazing. And to give these children a place where there is like sort of like a therapy and also like a possibility for like manual therapy and other things like that's really cool. And they probably feel like really special that they have you as a provider, and it's like not
I
just their
hope so.
doctor and it's not just like their mom, but there's like somebody that they can actually like form a connection with, you know?
Exactly. Yeah. Like we were talking about that's one of the reasons why I got into this medicine. One of the many reasons is because I think it's great to reshape how we feel going to the doctor. You know,
Mhm.
how we and it's really, self-care
Yeah,
or whatever, whatever term you want to give it, but taking care of ourselves shouldn't always be like a begrudging
right.
schlep to the, the gyno or the
Mhm.
PCP or that, like I think it can make medicine more fun, a more enjoyable experience at least.
Right.
But yeah.
And then making the providers like, us sort of holistic providers, really like the provider. And then when you go to the doctor, you just get what you need out of it.
Exactly.
You get the diagnostics, you get the medications, you get like, but you don't expect the relationship. I think people get so disappointed in their providers, their doctors, their OBGYNs, whatever specialists that they're going to. They feel, and then they come to see us and they're like, well, why don't my doc? And it's like, that's actually not what they do. So like we're
Yeah.
creating like a space for like actually creating a caring environment where we treat the whole person, and then, oh, your doctor is just going to fill that role and that role and that role and that role. It's just kind of like the bonus providers. Anywho,
Oh,
I totally digressed us, but other things that you've had success with treating, or you
uh,
can treat well, you just don't see it very often. People I'm sure
yeah.
are dying to learn
Um,
about.
colic in babies.
Oh, wow.
I've had some good success with that.
What does that treatment look like?
It's actually it's very gua sha based. It's a lot
Okay.
of scraping on the lung channel.
So gua
And
sha, if you don't know what gua sha
uh,
is, it's like the little tool. They're sort of like Graston tools. People use them on their like face, and we use it as it's like a rock that you use to massage.
yeah, and you can use
That's cool.
a lot of different tools, right? So I do have those Shawnee Shin tools I was talking about that are
Uh-huh.
specifically very gentle for kids. But you can use a soup spoon. In my practice, I use jar lids, like for jar
Oh my
lids,
God. Yeah.
and it works fine. And yeah, so it's a lot of that kind of, and the sha in gua sha means redness, right? So you gently brush the skin with the tool until you see visible evidence that you've increased the circulation with the redness. And sometimes it can look kind of road rashy. It really depends on what you're treating. Like if you're treating pain, and there's a lot of what we would call in Chinese medicine qi and blood stagnation, which it's usually at the heart of what's causing pain. It can be purple. It can be, it can be spotted red. It can be, um, it's really interesting. So you look, it can be diagnostic what comes up, but
Mhm.
it's basically I've had a few babies respond really well to some gua sha technique on the lung channel and on the back, like over the actual lungs.
Wow.
um and what else? I was making progress. I didn't get to really treat this patient as well as I had hoped, just because of scheduling, and they ended up moving away, moving out of town. But I was treating a young boy, the age of 14, with Tourette's, with a really kind of
Wow.
intense form of Tourette's, where it wasn't the classical presentation of involuntary speech. It was just a lot of involuntary movements, twitching, almost like spasming and then releasing,
Okay.
which presented a challenge. I didn't want to retain needles for very long, because if the muscles were spasming, I didn't want to cause any undue discomfort or things like that. So we did a lot of in and out needling, what I call wind needling technique, where to kind of spin the needle and then let the fascia wrap around it and then do a release that way. And
Wow.
yeah, it started to see some minor improvements, but I didn't get to see it through as well as
Yeah.
I would
Yeah.
have.
I mean, I can imagine that even if you can't like obviously cure the Tourette's because of where is that upper motor neuron? Is Tourette? I don't even know the
That's a good question. I wouldn't be
yeah,
able
I
to.
actually don't know if it's, I mean, and no one else really cares. Is it coming from the brain, or is it coming more from the periphery is what we're
Right.
asking each other. But I'm sure secondary stuff, in terms of like I don't think a lot of people understand as well as we do as providers, that like, there's underlying conditions and then there's secondary symptoms. And
Mhm.
like quality of life is really about treating those secondary symptoms. So for example, like somebody who experiences like endometriosis, right? I'm just using a
Yeah,
medical from like the pediatric, I mean, sorry, from like the pelvic world, but certainly starting to treat teenagers with endometriosis with acupuncture would probably be
right.
genius. But a huge side effect, right? Pain is like a really big piece of it because there's autoimmune and there's inflammation. But then like pelvic floor dysfunction, pain with sex, all of these other things are really secondary conditions that are treatable. Whereas, with disease and autoimmune disorders, like we're really trying to manage.
Right.
But as providers, like we're really working on those secondary things to enhance quality of life. So like long-term care for somebody with Tourette's or somebody that has endometriosis or other things that we think of as sort of really medical arthritis, so
Sure, yeah,
children or adults with some form of arthritis, like we're really treating those secondary complications so things don't get worse. So I can
exactly.
imagine like over time with that child with Tourette's, it probably would have been pretty cool to see,
Yeah,
his
well,
confidence change and the way he relates to his environment, what could have transformed and
yeah, exactly. And because it was also something where his symptoms got worse with stress. And
yeah.
and in
Mm-hmm.
stress, like that's something where acupuncture really shines, taking you from that fight or flight state, that sympathetic nervous system state, to the parasympathetic of rest and digest, which is
Mm-hmm.
where healing happens. Your body switches its priority from survival to starting to get through its to-do list, right, of things to take care of.
Mm-hmm.
Um, so that to me, when I went, that was one of my first questions. I'm like, do the symptoms get worse with stress? Because that's how I could kind of tell that acupuncture would probably be a good choice,
Yeah.
um, to help manage and get through. But
Mm-hmm.
yeah, yeah. I mean, you brought up a really good point too with endometriosis, like menstrual pain. It's it can be a really effective medicine for helping regulate the menstrual cycle, reducing PMS.
Younger the better.
The younger the better. So
Yeah.
many young women think it's just, it's your lot in life to suffer every month, and it
Mm-hmm.
doesn't necessarily have to be the case.
Yeah, for sure. I mean, certainly any parents of teenager, any parents who experience menstrual pain and then their teenager starts to experience it with their first, like we have the education now, so we know like get to it right away, the acupuncture, get to the doctor, do the laparoscopy, like do all the right things. So yeah, so basically like would it be a little bit, again, it depends, would probably be the answer, but like anything where like any set of symptoms or any sort of like, medical situation that a kid could be in, if stress increases the symptoms, whether that's, increases the GI symptoms or increases headaches or anything like that, that would be something that that child would benefit greatly from acupuncture. Yeah.
I, so I would suggest that. I think, yeah, like you said, of course, every human being is different, and every case is a little bit different. But I think as a general rule, if you see your child going through something that's exacerbated by stress, I think acupuncture is a great first resort. I think, and I throw very little shade to Western medicine. I think a perfect world is, like you said, we get our
Yeah.
diagnostics, and it's a blend. And if I'm in a horrific car accident, I'm not rushing to my acupuncturist. I'm going to
No.
get, right,
Yeah.
like, I think there's a place for everything. But I think as far as first resorts, things like PT, things like acupuncture, things like massage, things like, the more holistic approach, to me, I think is generally a good first resort, to see if that helps, to see if that kind of addresses more the root cause, as opposed to the branch symptoms, where multiple things can clear up if you
Right.
start to really get to the heart of what's going on. So yeah, I think that would be a good rule of thumb for parents or caretakers to keep in mind. It's like if something's exacerbated by stress, it could possibly be really helpful to seek out treatment.
Yeah. And then I also think, parents too get so stressed out over children's symptoms. And certainly all parents should be in acupuncture, and PT and all the things that we need. But the amount of relief, I think, that a parent who brings their kid in for treatment, and connects with you and understands, I think that the relationship between the child and the parent can really improve because the parent is able to get information from another expert. The child's able to like look and get a little bit of validation from the expert. And then that gets, because there is a dynamic that happens, like, when the parents it's not like no one's doing anything on purpose, but there is like always some dynamic that, and they can be all sorts of things where, the child feels like they need to act a certain way for the parent, or the parent feels like they need
Sure.
something else for the kid. So it creates an opportunity for a little bit more like honesty, I feel like, where everybody can just kind of get what they need,
Yes, yes.
relate in the way that they need to. Like it's like just like your mom, and her treatment. I'm just thinking about that and like how, even though you weren't the one being treated, how much community and ease that brought to your nervous system, like enough to like, steer your life in a particular direction. So that was a
Yeah,
really like long-winded way of saying that, but I'm just like, I could just feel like my daughter she's not going to any sort of treatment right now, but she goes to work with a personal trainer. So she goes to like CrossFit with a personal trainer. And um I have like a little bit of a relationship with the personal trainer in regards to my daughter, but my daughter and her have like a really like solid relationship. And
yeah,
having that, I can be like, hey, Becca, can you just like make sure you remind Hannah to like eat food, and like she needs to take a walk every day so she's not mean to me. She's like on it. And then Hannah always has, when she gets back in the car, she's so much nicer to me. Like, because
yeah.
it's like one thing off my plate, you know?
Yeah,
And it's
sometimes
one thing
you don't
off
want
her
to,
plate.
right. Yeah. Sometimes you just don't want to get the advice from your parent. That's just
Yeah.
human nature, I think. You just don't want to
Yeah.
be you, but then it's like, yeah, an adult that you trust who's, educated and there to look after you and in whatever capacity is like, you really should be doing the exact same things your mom told you
Yeah,
should.
exactly.
Like,
Uh-huh.
oh, great idea.
That's
Yeah.
such a great idea. I've never even heard of that. I never thought of it before.
Yeah. New information.
And you know
Yeah.
what? And parents will like, most parents, not all parents, but most parents will, kind of throw their ego out the window. It's like if their kid's going to do the thing that they want them to do, like they don't need to get that like, reassurance from their child that it was their idea in the first place. They're just going to be like, thanks, mom. Thanks
Yeah.
for doing that thing. This is so great. Like I feel like I learned like a ton. I mean, I feel like every parent that is dealing with sleep issues, children
Yes.
that aren't pooping well, children that
Yes.
aren't eating, and they're getting sort of behavioral and sensory stuff around eating, any sort of pain. Um,
Yes.
these are all things that can be like worked through an acupuncture. And I feel that headaches, these
Absolutely.
are all things that I feel like when you take some of these things to the doctor, you end up with some pretty heavy medicines for children that, may or may not help. And I feel like most parents want to avoid those heavy medicines. So
Yeah, well, again, it's about starting patterns young, right? So it's like if you're going reaching for a pill every single time anything pops up, it just makes sense that it's going to be the pattern throughout your entire life, and then you end up becoming it more than likely more dependent on chemical substances, and again, it's some people it's necessary. Some people really respond well, and that's the best form of treatment for them because they don't have any interest in going to an appointment where you need to lay still for 30 minutes.
yeah,
That's
yeah,
people's nightmares, right? So
yeah,
it's like rather just pop a pill, and that modality is there for the people who resonate with that, but
right.
for looking for different ways and to set different patterns and to kind of aid the body in healing itself as opposed to aiding the body to be reliant on outside
Mhm.
influence.
Yeah.
Different approach.
Yeah. And also another great one is when people have to take some sort of medication for whatever disease, acupuncture can help minimize side effects, right?
Oh,
Of
yeah.
you know,
Support. It's always a good support.
yeah,
Whatever the most appropriate treatment is. And especially, for kids and people of all ages going through cancer
Yeah.
therapy. It's a great support. It's really great at, I mean, the meds are getting pretty good now at helping with nausea. That's not really the issue that it was a few years ago, but still that comes up. The stress of
The
going through,
stress of it all. Yeah.
I mean, that alone, and sleep disturbances and pain and all the things that come up in the treatment of cancers, it can be really supportive while people are going through heavy intervention, to get through it, to recover from it. A lot of things people don't realize, I hear that a lot from patients I treat who have cancer, is that you have to recover from the treatments.
Of course.
You get the treatments, you recover from the cancer, and then there's also a significant amount of time where you are recovering from the roto-rooter treatments that you received, and that's just the nature of the beast at this point in time. And
Mhm.
so it can be really, really supportive
Yeah.
through all of that whole process too.
Amazing. Well, thank you so much. This was amazing.
Oh, thank you.
So enlightening. I feel like I learned a lot, as I already said that. And yeah, so Hallie's working at our office. She's taking new patients. Bring your kiddos in, or come for you, and
Bring the whole family.
the whole family. Thank you, Hallie. This was fantastic. And yeah, thanks everybody.
Bye.